All right. Thanks again. So for today, we'll focus on learning activity 1, which is evaluation of prescriptions. For you to successfully complete this learning activity, you must be able to evaluate a prescription in terms of the legality of the script before you dispense it. You must be able to evaluate a prescription in terms of whether that prescription is valid, whether it is authentic, and whether it is appropriate for the patient to whom we are dispensing. So in evaluating prescriptions, we use what we call LAVA or LAVA. So every prescription, you must assess it in terms of whether is this a legal script, is the script authentic, is it valid, and is it appropriate, right? So make sure that when you evaluate every script, you must make comments, and your comments are whether a specific component of the prescription, is there or not. So that you must always have a comment. Remember, if you don't comment, we don't know whether you know whether this is a compliant prescription or it is not, right? And what is important is that at the end of each prescription, you'll be expected to rewrite that prescription. So that is part of your portfolio of evidence. This section includes 3 prescriptions. After each prescription, there is a full discussion about each about each prescription, where it is clearly explained to say, this is the prescription, this is the issues around it. Once you have identified all the compliance and the non-compliant areas, you'll be expected to then rewrite that specific prescription, right? So when you assess a prescription, like I said, you assess it in terms of the legality, the authenticity, the validity, and whether this is an appropriate prescription. So here is, for today, we'll only do prescription 1 with you, because the aim is not for me to do your POE for you, but it will assist you. So here we have prescription 1. And as you look at it, it's from Dr. Motswana, right, who is a dentist, and so on, for Mr. J. Bean. And then there's a prescription which is written and some signatures there. So then the question is, how do you evaluate a prescription, whether it is legal, it is authentic, it is valid, and it is appropriate? Well, the first thing for you to do is to go to your guide. So if you go to your guide, specifically on page 30, you will find the legal requirements for a prescription or an order of medicines, right? And this is based on Regulation 28 of the Control of Medicines Act, right? So let's go through it together. And then after that, we will go back to that prescription of ours and see if some of these things are in place. So it says here, prescriptions may either be written or verbal, with the format depending on the circumstances and the schedule of the medicine that is being prescribed. Written prescriptions need to contain certain information. A prescription must be, legible in terms of writing. That is why it's always preferred that it must be printed, typewritten, or computer generated, because when you use your handwriting, sometimes we forget certain things. Also, a prescription must be signed by a person who's allowed to be a dispenser, a medical practitioner, a dentist, or any other authorized prescriber. So all of us who are doing dispensing course, we are doing it because we want to be an authorized person in terms of prescribing and dispensing of medicines. So a prescription must include the following information. So the name, qualifications, practice number, and address of the prescriber or authorized person, right? Very important. The name and the address of the patient, in the case of a prescription, or the name, address of the person to whom the medicines are to be delivered if the prescription is issued under by a vet, right? The date of issue of the prescription must be there. The approved name or proprietary name of the medicine, the dosage form, like when you say tablet, solution, or syrup, and so on. The strength of the dosage form and the quantity that has to be supplied, whether it's 28 tablets or 60 tablets, and so on. In case of a prescription, instructions for the administration of the dosage and the frequency. So it is a tablet, how must they take it, for example, at night or during the day, in relation with food, but also how often. Is it once a day, twice a day, or even 3 times a day? The age and sex of the patient must be included, because as soon as you say someone is a female and pregnant or not pregnant, or it's a child versus an adult, that's where you can assess the appropriateness, whether the drugs that have been prescribed are suitable for the person who's in front of you, and then the number of times the prescription may be repeated if we need to repeat that prescription, right? It's also important that the prescriber must also keep a record of the diagnosis relevant to the prescription. So why are we prescribing? We don't have necessarily to write the diagnosis on the prescription. However, if you write the diagnosis on the prescription, it will be very helpful to the dispenser in terms of when we need to evaluate whether the drugs that have been prescribed are appropriate for the diagnosis that has been made, right? The laws also allow for prescriptions to be faxed or emailed, or even for telephonic scripts. And in the case of this digital form of scripts, the person who's authorized to dispense the medicine must verify. So if you send a telephonic script, the pharmacist on the other side needs to verify the prescription to ensure that they're talking to a credible health worker, verify the prescription, whether this prescription meets the minimum criteria for a valid script. And what is very important is that if we use any of the digital means for prescribing, yes, the drugs can be given, but the original prescription needs to arrive at the pharmacy within 7 days of the drugs having been prescribed. This is for audit purposes. Prescriptions have a limited life. For example, prescriptions for medicines expire after a certain period. So generally, all prescriptions are only valid for 30 days. So it means if we prescribe drugs for a patient today, they need to submit that prescription before the 16th of August. After the 16th of August, it's likely that it's after 30 days. Therefore, that prescription is no longer valid, right? Also, the prescriptions might be repeated under specified circumstances. Therefore, it's important that the relevant laws are followed. And in terms of repeat prescriptions, right? It depends on the schedule. So for schedule 2, 3, and 4, medicine may be repeated, and we just write it next to the prescription, and the prescription cannot be repeated for longer than 6 months, right? But you would know that during COVID restrictions, the president and the minister had to make regulations to allow for chronic medicine prescriptions to last longer, because we are under lockdown restrictions, and because of limited movements, some prescriptions might expire and people living with chronic diseases might struggle. Prescriptions for Schedule 5 medicines may be repeated if it's necessary, right? But it can be repeated and intervals at which it can be dispensed. So the prescription also cannot be repeated longer than 6 months. However, Schedule 6 drugs cannot be repeated. So that's quite very important, right? So So the other thing is that remember that all pharmaceutical records must always be kept for at least 5 years. So whenever you are prescribing, you need to have prescription records that you keep. Each prescription must have a prescription number so that you can trace it when it's needed. And we need to ensure that you keep those records for a minimum of 5 years. So that is very key, right? So we need to go through additional information about prescriptions. But as you look at this prescription and some of the things we have discussed, you need to assess whether the name of the prescriber is there, their qualifications. Is this a valid practice number? Probably not. Is there a contact number and an address? Like for the patient, we need to have the full names of the patient. The age is there, but is this a male or a female? Where it's allowed, you can even add the diagnosis if it's not too confidential. Male, female, if it's a female, is she pregnant? So all that kind of information is very important. And you can see here, there's no date of this specific prescription, so that becomes quite important. And then you can see the different drugs that have been prescribed, but also this is a funny looking signature. So you need to assess the validity of this prescription. It's also not written whether this is for 1 month or 2 months, but the number of tablets have been calculated. So it's very important that you're able to evaluate a prescription and therefore write it properly. Now, before we go through this script again, if you go again, now more detailed information about the prescriptions, you'll go to page 137, right? So here we talk about evaluation of a prescription. So we need to make sure that you understand how to evaluate a prescription. Like I said, we use this acronym LAVA, L-A-V-A. So we are assessing prescriptions in terms of their legality, authenticity, validity, and whether it is appropriate for the patient. So every time before you dispense medicines, you need to assess a prescription in terms of these 4 requirements, right? And also where it starts with preparation of the prescription. So each facility, so your unit, your clinic will have its own procedure. You must have a procedure around how you prepare prescriptions. It's very important that you are also able to provide counseling in terms of how to handle medicines, ensuring that patients are informed and they're able to fully participate and be active, participants in their treatment. So that's quite important. Now, one of the first things which tells us about validity of prescriptions is the ability to identify the patient, right, and the prescriber. So every prescription must have ways in terms of how we evaluate this. So when you receive a prescription for dispensing, the patient and the prescriber, both of them must be identified before you issue the drugs. And how do we identify the patient? By the name. So the name of the patient must be identified as well as the address of that patient. So when we go back to our prescription, we do have some name of the patient, but we do not have any contact details, no phone number, no work number, and we don't have the address of this patient. So that is an important weakness. It must be established whether the prescription is for a person presenting the prescription or it's for someone else. So sometimes an adult might collect medicines for their child, or I might collect for my brother. So it's very important that it's clear who the medicines are for. when the medicine is for another person, you need to ensure that the necessary steps are taken to ensure that the drugs would be able to be delivered safely, right? And information about the dosage and storage should be provided to the patient or the responsible adult. The following information about the patient must also be checked. For example, the age of the patient. I think in our instance, it was included, right? And then obviously, if it's a child or an elderly, that helps us to assess whether the dose is appropriate for them. We need to have clarity whether we are dealing with a male or a female. And if it's a female, is she pregnant or breastfeeding? Because some medicines would be contraindicated. Information about allergies must also be included. So it's very important so that we can identify which drugs we must avoid. Also, if a patient suffers from other medical conditions and they're taking other drugs that might interact with the disease or even with the other drugs, we need to make a note about that. It must also be established whether the patient is taking any other medication so that we are able to identify drug-drug interactions, right? So in other words, here we need to know, okay, Mr., we presume it's a male, but it's always important to verify that it's a male patient, 33 years old. Where do they stay? There must be, an address. And if we can even get more information about the patient, if they've got other comorbid conditions, if they're taking other drugs which are not part of this prescription, if it's a female, whether she's pregnant or breastfeeding, it's very important. And also remembering that the person who's a female pregnant might be at home and someone else might be collecting the medicine. So don't judge the script by the person in front of you. We need to judge the script by the person who is going to consume the medicines, right? So in terms of the prescriber, the qualifications need to be there, a valid practice number and address. These are the things that we must identify. The category of prescriber must also be identified. In terms of the scope of practice with regards to prescribing medicine must be ascertained. So for example, this is Dr. K. Motomitswana, right? We know that he is a dentist, and we just need to make sure that this practice number is valid and we have his address, right? But now he's a dentist. We need to make sure that whatever he's prescribing also falls within the scope of practice, of dentists. For example, if you get a dentist prescribing anisole suppositories, you should really ask, how did a dentist make a diagnosis of constipation? That is beyond their scope. Dentists, by design, they are meant to deal with oral issues. If it's a nurse and they are prescribing schedules above 4, we know that they need a doctor, because in terms of essential drug list, it's at least up to schedule 4, not necessarily schedule 6. So all those kinds of things are quite important as you identify the prescriber. So for now, we know we need to identify the patient or the person who's going to consume the drugs, and also we need to ensure that this is valid in terms of the doctor. We also now need to establish the legality, whether this is a legal script, whether it is authentic, valid, and it's appropriate, right? So once you have confirmed the identity of the patient and that of the prescriber, we then have to assess the same prescription, whether is it a legal script or not. So it must be confirmed whether the prescription complies with all legal requirements. So legality, which is the first thing we assess for, is, does the prescription meet all legal requirements? For example, does it have a date of issue? If you remember, our prescription does not have a date, right? But also if it has a date, it's a question of, is it within are we seeing the script within the 30 days from when it was prescribed? Because prescriptions are only legal within 30 days of being prescribed, right? Do we have the approved name and quantity of the medicine? Do we have the name and the address of the patient? Do we have the name, qualifications, practice number, and address of the prescriber? Do we have the dosage form and the strength of the dosage form? And then do we have complete instructions for the administration of the dosage and frequency? So how the drugs must be taken, is it clear? And then the age and the sex of the patient, and then the number of times the prescription might be repeated. So these are the elements you need to assess for when you assess whether a script is legal. So coming to our script, number one is that we don't have the sex. Maybe Mr. Is a male, but it's always important to have a section where you say male or female. So that's very important. We don't have the address of the patient. The prescription does not have a date, right? The medicine names are, I think they are written properly. Just need to check that everything, is written properly. And the dose formulation is there, but it is not clear whether they will take these drugs with food, without food, what precautions must they take, so sometimes that kind of information is important, and whether this signature is valid. So in terms of legality, this prescription is not legal. It's not a legal script because there's additional patient identifiers which are not included on this specific prescription, right? So the second part is to say, is this authentic? Is this reliable? Can you trust it? Do you think it's undisputed, like it's a genuine certificate? So to check for authenticity of the prescription, it is necessary to check the patient details, the identity, as well as, so you're comparing the information that's on the prescription in relation to the patient. And the following information must be checked. Whether the prescription is genuine or whether it is forged. So you look at the signatures, you look at the practice number, whether that practice number is valid. Is this a patient who keeps on coming for the same medicine time and time again? So we might need to look at that. So we need to assess whether the patient is in fact who he says she is, right? Because someone can pick up a prescription on the floor and come and present it and say, this is mine, but all they want so from a public patient, you might want their booking card, which has their file number. From a private sector, you might want to verify either by ID or even by medical aid card. So you want to verify whether this patient written there, the person who's bringing the prescription, is it, the correct patient. You also want to assess whether the prescription was written by a person who's authorized to prescribe the medicine, right? Whether the prescription was in fact issued by the prescriber, because there's a lot of fraudulent activities around medicines, especially Schedule 6 medicines and expensive medicines out there. So authenticity becomes very important when there is a suspected misuse or abuse of drugs. So there are drugs that are known, things like your morphines and your antipsychotic drugs, sleeping tablets, people abuse those. So if for any reason the information on the prescription does not appear authentic, the person dispensing the prescription must consult with the prescriber, right? So even here, we can just call the prescriber and say, hey, I'm seeing your prescription, but you have not included the patient's address. I don't have a patient identifier. Laws also require that a prescription must have a unique number, a unique identifier, like a prescription number. So you could add a prescription number, on top there. We might want to verify this funny looking practice number because it's possible that this is not a proper one. And then we call the number to check if this is an authentic. But on an eyeballing, it looks okay, but you just a few things that we need to verify to ensure that, and also to check whether Mr. J. Bean, the person in front of you, is the real Mr. J. Bean, or they've just picked up this script and they just want to abuse the drugs. So that's authenticity. So legality is whether this is a legal script. There's things that we check. Authenticity, is this a fraudulent? Can you trust this prescription? So that is the second assessment that we do. And then the third assessment is this prescription valid? When checking the validity of a prescription, it must be confirmed that the information of the prescription is correct and sufficient. And the following questions must be asked. So think of time. If you can get the time right, usually validity will win. So has the prescription expired? That is the first question. So it must be noted that prescriptions are only valid for 30 days from the date when they were issued. So if they prescribed and it has went beyond 30 days, it is not a valid date. So it might be legal script, which means everything is in order. It is not a fraudulent script, but the prescription is presented a bit late in terms of dispensing. Therefore, we cannot accept this prescription because it is not valid. Also, the repeat. So if it is a repeat prescription, are there any repeats left? So if it was they gave 3 months worth of repeats and maybe this is the 4th month, that's very important. So every time a repeat is issued, the fact that a repeat has been given must be recorded in order to control the number of repeats issued, right? So if there was a repeat month 1, month 2, month 3, and now it's month 4, it means that prescription is no longer valid. And you might need to call their doctor. And if they say no, they need to come for an assessment. Therefore, you cannot continue the medicine. So remember, validity is about time. So 1, have we gone beyond the 30 days? 2, can we repeat this script, or it's not a repeatable script? Remember, Schedule 6 medicines, you can never repeat them. So in terms of so this one is not valid because we don't have a date. We don't know when exactly was this prescription issued. So that makes it not legal. It is not authentic because there's no date, but also we cannot verify whether it is a valid prescription. And there are no repeats, so this prescription will only be issued once. Therefore, if it comes back for the second time, it would not be a valid script. And the last bit is appropriateness for the patient. So is this prescription appropriate? We're assessing the appropriateness of the medicine prescribed for the patient, right? And we want to see whether certain steps were taken in preparing this prescription and that there's no risk of harm to the patient. So what's your interpretation of the type of treatment and the prescriber's intention? So even if there's no diagnosis, so you are looking at the patient in front of you, you are looking at the prescription. What are we trying to treat, and then were the medicines clearly identified? Are the dosages correct? Is it the right strength, the route of administration, and the duration of that treatment, right? Assessment of the prescription to ensure optimal use of medicines, because sometimes people are over-prescribing, whether in terms of the number of drugs that are being prescribed or even the duration, right? So each prescription should be assessed by a person dispensing the medicine on the therapeutic aspects. Are these medicines safe? Is there possible drug-drug interactions, drug-disease interactions, interactions with food, or even duplication of treatment? Is it appropriate for individuals, including their socioeconomic aspect? Because sometimes we prescribe expensive drugs that patients will not afford to pay for. And then that creates a lot of other problems. So, and to assess this, you might need to have questions that you ask the patient to say, how are you? What was the cause for your admission? You might have questions to the prescriber where you have doubts. And then you might need to open your formularies and check, these drugs that have been prescribed, whether these are safe drugs to be given together. And then you can, even if there's a register of approved prescribers, you can check whether this is an approved prescriber. I know in public hospitals for Schedule 6 drugs, there are specific people who are allowed to prescribe. So if the prescriber is not one of those people, they might not be allowed to prescribe, right? And then if you feel like, I'm not sure whether this is valid, authentic, or valid, it's best to consult and not just give drugs because we do not have time. So in terms of the question of appropriateness, these drugs are general antibiotics and painkillers from a dentist. So one presumes that maybe this patient has some infection, maybe an abscess or something in the tooth, and whatever it is, it's painful because some pain medicines have been prescribed. But what if he's a known patient with peptic ulcers and we've prescribed Brufen? Does he know that when he takes Flagyl, he's not supposed to drink alcohol, for example? So if he's an alcohol abuser and taking Flagyl, this might be dangerous for his health. So that's how you assess the appropriateness to say these drugs, the dosages and the routes. What if this was a 2-year-old child and we had this drug? We say, well, this is not appropriate. The child cannot swallow these tablets. The doses are too high, and then we deal with it like that, right? But for Mr. Bean, who is 33 years old, the prescription seems appropriate and it's prescribed by a dentist, so there's probably a problem in the mouth of that patient, right? So whenever you suspect issues around legality, authenticity, validity, and appropriateness, consult the prescriber and we try to resolve the issue with the patient. Otherwise, you cannot continue to prescribe like that, right? So that is it, on the prescription. In terms of the task, for example, we have evaluated prescription 1. I was giving you tips. You'll do the same with prescription 2 and 3. As you browse downwards, you'll see that we have done LAVA for you. Remember, LAVA is legality, authenticity, validity, and appropriateness. So this script is already evaluated for you. So you'll have to read to say the name is present, the address is too short, qualifications are there, there's something wrong with the practice number, and then now this exercise, when you do your POE, you see, so here you can see it says date presented. So the day you are evaluating the script, you're gonna put that date there. You're gonna put that date there. Then you put your SUNC number or your MPH number. You read. It says your patient details. The patient name is present, JBIN address and ID number are. So address and ID number are, you have to fill it in there. What do you think? They are not included, right? They are not there on the prescription, right? The age and the sex, gender are present. I guess when they say Mr., it means male, right? It is a good idea to verify with the doctor whether when he said Mr., he meant male, because remember now, gender roles are changing. So you can have a female Mr. and so on. So it's quite important to look at it like that. Then you check whether, so the drug dosages, it seems like they've covered the duration, the frequency, the route, everything, but there are no instructions, right, to the patient, right? So you read, you're gonna fill in the missing words in reviewing prescription 1. So you continue with it, filling in the missing words, reading about the feedback around that prescription. As soon as you are done, you need to rewrite prescription 1 correctly. So now that you would have a better understanding of the gaps, you are now designing prescription 1 properly, right? But now you are the prescriber, right? The prescriber is no longer the dentist. It's, let's say, you use your address, you put a practice number. Even if you don't have, you can put a dummy one, you can use your home address, and that's it. You would have done prescription 1 at that point in time. So I think I have showed you, how to evaluate based on the guide and what you need to do. Then after that, you look at prescription 2. You can see it's a group practice number. There's a whole lot of doctors who work there. There's a group practice number or something. So whose practice number is this, And then, so you're going to have a lot of assessments to do in terms of here. And then there's your patient. Again, there's no address. What do you think of this date here? It's too old. So is this prescription valid? No, it's not valid. Why? Because of this and this and that, right? It's too old. And then there's two drugs that have been prescribed. You need to open your formulary and check appropriateness, whether the right drug, right dosage, 11BD. But already here there's a problem. Is this a tablet? What is this? A tablet or a capsule or a what? Or is it? So the dosage formulation, I don't see it. So you'll evaluate there, even the instructions on how to use it. And then who's this one? Ching Ing Ling. Is this one? So then I don't know. You need to evaluate this prescription very carefully and ensure that and check if these two drugs can also be given together. And this is a male patient, so you that's how you handle it. But after you do that, you go through this activity. So you need to read all the sentences and then always select one word. So legality, is this statement legal or illegal, right? The fact that there's no patient address, it makes it illegal, for example. So it cannot be, so you'll cancel legal, you'll be left with illegal, right? You always draw a line on the incorrect word. So you'll say through legal, you put a line there. So this is an illegal script because of some information is missing. Is the date present or not present? Yes, the date is present. So you're going to cancel out absent. However, it is outdated. So you're going to continue to do that throughout this document, answering all those questions and filling in the missing words. Then you, based on your understanding of prescription 2, you then redo prescription 2 correctly, right? And then you continue, you go to prescription number 3. It's another group of doctors. You check there, it's a female patient. Now you're going to need to check a lot of things, right? We don't know whether she's pregnant or not. The prescription does not have a date. There is no patient address. We have the name of the doctors. We have their qualifications. We need to check the schedule. Don't forget to check the schedule of these drugs. So you go through it, you evaluate it. When you are done evaluating it, and also, the way the drugs are prescribed is very important. The instructions in terms of appropriateness. And then check this drug. Which schedule does it belong to? And then is it allowed to be repeated? And those kinds of things. So you need to look at your books there. But luckily, you'll read here. You'll read and read and read. So evaluating a prescription for, so you read, you just fill in the today's the day when you're evaluating, you put a date there, and then you continue, so there's no date. Remember, there's no date. So, and then also one of the drugs is a Schedule 6 drug. Remember, we said there are no repeats for Schedule 6 drugs, and then you must check if it's a female patient and this drug is contraindicated in pregnancy. So you have to ask the patient about whether they are pregnant or not, whether they have got any chronic diseases, and so on. Then once you have read through the script, so you need to correct the script. You take whatever your analysis up there with the script, you redo the script, but now you are the prescriber. So it's under your name, your heading, with your credentials, your address and everything. Then you put it right there. As soon as you do that, you would be done with learning activity number 1. Right. Yeah, so that is what you're going to do. It's a task that I'm giving you today. You have a week to do that. You may continue with the other elements of the POE so that when we do them, you just update your POE. But for today, we are going to stop there. I think I've given you a better understanding of your first learning activity. Make sure that before we meet again next week, Thursday, you have completed this activity, and you continue with the others. And then as we go through them, you make corrections, you improve it, and then you win. Right. So yeah, thank you very much for